Hello, everybody. Welcome to the EQPOD podcast presented by Botukiller USA. I am very pleased that our next guest gave me a second opportunity to interview him. I interviewed him out at the AAEP booth. Dr. Lorenzo is going to talk to us about some alternative therapies for endometritis. But before we do that, I'd like for Dr. Lorenzo to introduce himself and give us a little bit of background of who he is and what he's all about. Dr. Lorenzo, welcome to the podcast.
Hello, Ty. I appreciate the opportunity to be here again. Thanks so much. So I'm Dr. Segabinazzi or Dr. Lorenzo. I'm originally from Brazil. I graduated in 2014, so a little bit more than 10 years right now. Since my vet school, I've been always a vet student and a equine vet. And since there, right after I graduated, I work a little bit in the field with equine reproduction. And then I joined a master and a PhD right after at São Paulo State University. And I did my PhD also at the University of Illinois. Both of them were with alternative therapies for endometritis. So I work a lot with platelet-rich plasma and other therapies. I've been studying this for a while. And in 2021, I joined the Ross School of Veterinary Medicine, first as a postdoc, as a researcher here. And right after, I got hired as an assistant professor of thyrogenology. So nowadays, I am an assistant professor of large animal thyro here at Ross. The university is the campus where I am right now is in St. Kitts and Nevis in the Caribbean. So I can't complain for where I live, actually. It's a really nice place to be.
Yeah, especially considering the weather that we're getting here in the U.S., Texas, and that area is getting hammered. I know for me, I'm used to it in the wintertime here in South Dakota, being, 0 degrees, if not negative temperatures, especially with the wind chill. So we are very envious of where you live. So yeah, let's not keep talking about that.
Yeah, it's kind of been chilly here. I mean, 65, 70 Fahrenheit, but it's different than it usually is.
Yeah,
But it's
I don't
good
think
though.
you're ready
It's
right now.
good though.
Awesome. Well, let's talk about endometritis. I know we've had a couple of guests talk about endometritis, and it's always interesting to hear different perspectives, especially, how to treat it and really where it starts, because if you don't know where it starts, it's really difficult to treat. So in your opinion, I should say in your perspective, what is endometritis? Why are we talking about it?
Yeah, I think endometriosis is always a really hard topic in any equine meeting. Why that? Because we know that endometritis is one of the most common cause of subfertility. It is the most common cause of subfertility in equine species. That's been studied for a while, as there are reports in which people say, like researchers, they look for the most common conditions in the equine world, and endometritis was considered the third most often overall. So this is a really important disease that affects mares and reduce the fertility of these animals. And reducing the fertility, of course, reduce the money that come to our pocket when we work with these animals. What is endometritis? Endometritis is basically the inflammation and infection of the uterus of that mare. So when I say inflammation and infection, or infection means that some mares, they will have what we call post-breeding induced endometritis. That's just that endometritis caused by the sperm. It's physiological, but in some mares, they are exacerbated. So those are the mares that we consider them susceptible to endometritis. Usually, who are these mares? Are those that they are older, they've been bred several times. Usually, who will be those mares that we really need an offspring because they are really important. So this makes this disease really important for the equine practitioners to know how to work with. What will be those mares with infectious endometritis? Usually also the susceptible mares that they acquire, besides that physiological and exacerbated inflammation, they will also acquire an infection, usually bacterial infection, but can also be fungal infection. Not as often, but also happen and is really important and cause catastrophic loss in the equine world.
Sure. So then thinking back, obviously we're going to talk about some alternative therapies, but thinking back 10 years ago, 15 years ago, what was treatment? What did it look like, when you first started in the field? What was the options for treatments?
So in the past, like I think if you look in the past, like more than 10, 20 years ago, we see that the first treatments were basically using antibiotics, like oxytocin, uterine lavage, and antibiotics. But we know that with the advance of the medicine and with the advance of the bacterial resistance, we want to avoid more and more and more to use antibiotics in our nurse. So that's been more and more important to create these alternative therapies. In the past, what we consider alternative therapies was using oxytocin, maybe prostaglandin. They are equine drugs, and we talk about equine drugs are the drugs that help the uterus to push the fluid out, and the uterine lavage to physically remove that content from the uterus. And this, of course, nowadays not that alternative. As I said in my presentation, I don't think the alternative therapy is the best word because we don't stop using uterine lavage, right? We don't stop using oxytocins. We try to stop using antibiotics as much as possible, but I think the adjuvant therapies would be a best because we combine them with other therapies that may help us to treat that infection or that inflammation that is in the uterus.
Yeah, that's a great point, because when you say alternative therapies, most people think this is going to be a brand new, never been done before, but really it's an advancement or an adaptive therapy.
No, yeah, it's an adaptive therapy for sure. Like, and sometimes I like to say that that was a good topic because sometimes they are simple things, like as I show, like using iodine, things that we already use in our routine for other things. But of course, we need to know which one is safe, how to use, when to use, why this would be a good alternative for that treatment. So that's the important thing about knowing these alternative therapies.
Yeah, and I think you brought up a good point, understanding why we're doing it, because I talk to a lot of people that are like, hey, I've got this older mare that I have not been able to get pregnant the last 2 or 3 seasons, and we're just shotgunning everything. We're doing everything, but never once do they say, hey, we're trying this because we think this is happening. And it's just this shotgun approach of like, let's try as much, different products and different companies that have different products, and then maybe something happens. But really what you're getting at is like, let's understand why we're doing what we're doing before we do it, right?
Exactly, and know how to do, like how and when it's properly to do.
Yeah, you brought up the antibiotics. One of the things that I want you to talk about is, we could talk about the antimicrobial resistance problem, but is there another issue if you just use antibiotics as far as if it's going to work or not? Like, what do we have to be careful of other than antimicrobial resistance?
Of course, besides antimicrobial resistance, right before my presentation, doctor present some data from his practice, and he's shown, and we know that if you infuse antibiotic in a mare that has pus or has dirty fluid inside of her uterus, that antibiotic won't be able to effectively kill the bacteria, even though that bacteria is sensitive to the antibiotic. Because those debris, all that pus, all that content will inactivate the antibiotic. So that's why it was one of the things that I push a little bit and I stress during presentation is we must at least clean that uterus before we do, and not only antibiotic, any other therapy. Before I do my PRP, before I do other things, that uterus must be clean. So some people, they want to go to the easiest approach, and I think, oh, I can just mix this with this and put in the uterus and it will work. And that's not, you are just, besides it's not working, you are increasing bacterial resistance. So what is a big problem, not only for the animals, but for us, for the humans.
Yeah, and one other point is too, we talk about time is money. As you're using these different, products and stuff that you don't know why you're using, you're prolonging that issue and you're not addressing it right then and there, right? So take a little bit of time up front to understand what you're doing so that you can get back to, a healthy mare that produces a healthy pregnancy. And in the end, the end goal is to get a foal. So what are the couple of different therapies that you talked about in your talk?
So, talking about this cleaning the uterus, we talk about like knowing what you are treating. You stress that before. So many times when we need to know, we need to do a diagnostic. This diagnosis for people that they are not able to, for example, do a culture and a sensitive test at home, they need to submit to a lab. We know that this may take 48, 72, 96 hours to get a result. And what are you gonna do during this time? Are you gonna just sit and wait? No. I think this is when the adjuvant therapy comes like and plays a pretty big role. Even though if you are treating later with antibiotics, makes sense to prepare that uterus during those 2-3 days to receive that antibiotic. And then okay, now I'm treating with antibiotic, but I know that my antibiotic will properly affect that bacteria. For that, we can do, I really like to do a lot uterine lavage with iodine. And with iodine, I don't like to do more than 1%. And you need to make a calculation that will be a 10% solution of betadine. And then you're going to use 1 ml per liter to make that solution available at the concentration that you want. We know that much more than that, you can use up to 10 ml per liter. I prefer between 5 and 10 ml. I usually will use 5 because much more than that, we know that then the iodine starts to be toxic for the cells. What I like to do is mix this iodine with distilled water. And if you go to the paper published in the AP proceedings, there's not only distilled water, we need to put salts to control the osmolarity. But why distilled water? No, because costs. You can do the same thing with lactate ringer solution. But how much costs a gallon of lactate ringer solution and how much costs a gallon of distilled water? If I have money, if my mare is really important, the owner is willing to pay, I'm always gonna pick lactate ringer. Always. But if I want to kind avoid to spend so much money and I know that that uterus is already dirty, so I can use for this first lavage that distilled water with iodine. Other possible therapies, hydrogen peroxide. I really like to use hydrogen peroxide. I don't go much more than 1% solution. So you're gonna buy usually is 3%, but you may find 10% hydrogen peroxide solution. So when it's 3%, usually I do 1 part of hydrogen peroxide, 2 parts of saline. I prefer saline because of the pH is a little bit lower than lactate ringer. So I prefer that for treatment. But you can use lactator and it will be the same 1%. Infuse in the uterus of the mare and then give 5 to 10 minutes and then flush that uterus again. So those are nice therapies, simple therapies that can be used to start a treatment. One good treatment that I talk about is after this lavage, I always like to go ahead and infuse the Botukiller. And because we've been studying Botukiller, we've been using a lot in Brazil for like the last 10 years, I think, and helps a lot with like simple to treat endometritis and helps also to treat those difficult to treat endometritis. Of course, we need to associate them with other treatments, antibiotics. But after I do all that first cleaning with these alternative therapies, this iodine or this hydrogen peroxide, I just infuse. Usually I'm gonna infuse two vials of Botukiller, and then I'm gonna look at that mare again next day. Next day, same thing. Flush, remove all that dirty material, infuse another 2 Botukillers, and maybe I'm gonna do this for 2 to 3 days. And then I'm gonna, after that, start my proper treatment if needed with antibiotics. Of course, we are talking about back infectious endometritis here. When it's post-breeding endometritis, usually we're gonna approach in a different way.
Sure. So by the time you're done, lavaging and infusing, you should get results back from the lab to establish your care, right? What other therapies? Also, my disclaimer is I did not ask Dr. Lorenzo to talk about Botukiller. Botukiller is one of our products. So we're not paying him to talk about it. It's
No,
unsolicited.
but Botukiller has been a field of study. Like we've been studying Botukiller, and we've been using in Brazil. I use here. It's a good alternative therapy, and it's an adjuvant therapy. I'm not saying that I don't use only Botukiller. I use Botukiller to help with the other therapies as well.
And would you say that's more on the affordable end or more on the expensive end?
No, I think it's pretty affordable. It's pretty affordable for what it does. For sure.
Yeah, so I love that you talked about, hey, if you're on a budget, if you're worried about costs and you don't want to pay for the lactate ringer, you can mix your own. What other therapies other than Botukiller, what other therapies would you
We love
suggest?
to use plasma and platelet-rich plasma. It's another thing that usually it's pretty difficult that I'm gonna use only PRP. But I get this mare, and then after I'm gonna produce my own PRP, and I'm gonna infuse in her uterus. Depends of the mare. Some mares I'm gonna do after breeding, some mares I'm gonna do before and after breeding, because I know that PRP improves the uterine health, improves cell proliferation, mitigates inflammation of that uterus, and has also some antimicrobial properties that we've been studying a lot and has shown that. So these therapies help with that as well. So PRP for me is another therapy that's pretty affordable. We know that there are several kits that they might be a little bit expensive to buy, but we can also make our own manual protocols using just the same centrifuge that you have to process semen. So, and we remember, when we are dealing with mares, that PRP, of course, need to be clean, but doesn't need to be as sterile as the PRP that you are injecting in a joint. That's a different story. So we can use manual protocols to produce PRP for the uterus, and it's a really, really good alternative therapy for the area.
Do you have any good case studies that you can talk about, whether that's on the Botukiller or on PRP?
For sure, like I did my master and my PhD with PRP. So during my master, I bred mares that they were susceptible to endometritis. We characterized them; they were susceptible, and I made 3 groups. One group mares would receive just a placebo. One group mares received PRP before breeding. One group mares received PRP 4 hours after breeding. And we showed that the mares that received PRP, they had a higher pregnancy rate than the mares in the placebo group, our control group. These mares also, the mares that received PRP, they also had lower polymorphonuclear counts in the biopsies and in the cytologies, showing that the immunomodulatory response of the PRP in the endometrium. And then later in my PhD, what I did, besides that, I did with embryo donor mares that were really susceptible to endometritis. And besides that, I also test the plasma. And we show, because many people say, can I use PRP? Must be PRP? Can I use plasma? Basically, the difference is the amount of platelets. And we show that the PRP has a beneficial effect compared to the plasma, but both improve pregnancy rates and both mitigate inflammation. So if you are working with a mare that's really susceptible to endometritis, you know that the history of that mare, I would go with PRP because we know that PRP has more antimicrobial properties, much more than the plasma, and has a more potent effect on the immunoregulation of the uterus. However, it's too hard for me to do PRP. I want doing several mares. I would do plasma and would work in some extent. It's better than the control. Anyway, for Botukiller, we've done a study with Dr. Canisso, and we show that the in vitro properties of Botukiller against a bacteria that causes endometritis in mares. Botukiller was able to stop the growing of these bacteria, all the bacteria. So shown the antimicrobial activity of the Botukiller against these bacteria. There are other research going on. We show the safety. I present some data at the AP because we bred some normal mares because some people they got, okay, it's safe to put in the uterus. Clinical practice for us that work in Brazil before, we've been using this for 10 years. We know that's safe because our mares, they've been giving us embryos and getting pregnant for all this time. But now I did a properly approach. I bred some mares, did some biopsies. The endometrial architecture remains the same after the Botukiller. And also we did some crossover study with some normal embryo donor mares, and we showed that we using Botukiller or not using Botukiller for those normal mares, the fertility rates were completely similar. So it's safe to use. I hope there will be more data later working a little bit more on the problematic mares, not the normal mares.
Sure. So where else would you say, other than Botukiller and the PRP, is there anything else, or what do you recommend for somebody that is maybe skeptical about both of these? Like, hey, my grandfather never used either one of this. My dad never used it. So, like, what would you say to somebody that is
There are
skeptical?
several. I think there are several alternative therapies we can talk about. Kerosene, coke has been discussed a lot because people have started using coke. And I'm not gonna lie, at the beginning I thought it didn't work. And I did some tries. And I got some mares getting pregnant after I infused coke in the uterus.
Coca-Cola?
Coca-Cola.
Okay, I just want to be clear.
Coca-Cola. There are some people that they like to use other drugs like stem cells can be used. What else? There is a list, but ozone has been studied a lot. So always depend what type of mare you are using. You are not gonna use, for example, kerosene in your mare that gives you embryo sometimes, but you know that she makes fluid. No, kerosene will be for that mare that she's bearing for 2, 3, 4 cycles, 1, 2 breeding seasons. You've been culturing positive or not culturing anything for her uterus. You don't have anything else to do. Then you're gonna go and infuse kerosene on her uterus. And when you infuse kerosene, you need to be careful with yourself. You cannot use rubber material. When you infuse, we are gonna infuse between 200 and 500 to a liter inside of the uterus and leave there for 24 hours. Next day you go and remove. Important to talk about kerosene. Many people say, oh, kerosene kills everything, right? But no, kerosene does not kill bacteria. Bacteria actually grows in kerosene because of the carbons in the kerosene. They can use as a substrate. The thing is, the kerosene will cause a chemical curettage in that uterus. So all that biofilm, all that bacteria that was dormant in that uterus will suddenly wake up. And then after that, the immune system of that uterus will attack and will be able to get rid of that bacteria. That's the hypothesis, and that's what has been shown. You can also use the kerosene and after treat the mare. Just need to be careful because that chemical curettage makes the mare sometimes sensitive. So don't lavage with iodine. Don't do other things like lavage with neutral solution, lactate ringer. If you need, use systemic antibiotics if you know what bacteria is there. So just be careful. And similar to Coca-Cola, we don't have many studies. I have some data to present still about the safety that I present there. We did some biopsies that showed that the Coke is safe for the endometrium. But we also did some study that we evaluated the effect of Coca-Cola in vitro against bacteria that cause endometritis in mares. And similar as kerosene, Coke, the bacteria grows with Coke.
Wow.
Because there's a lot of sugar there. Yes, the pH is really low, but bacteria grows there. So the hypothesis is the same, that because of that low pH, because of that hyperosmolarity, probably there is a chemical curettage in that uterus. similarly as kerosene, but a little bit not as important, that will help that uterus to get rid of the bacteria.
If I had a time machine, I would love to be in the room when the first guy said, "Hey, let's try Coca-Cola in this mare's uterus." Like, to me, it blows my mind that we're using
Yeah,
Coca-Cola.
it's interesting. I remember when I was in the first meeting that they come up with this, and I say, makes no sense, because it was just a clinical trial and they didn't have controls, of course. So I say, it's not the Coke. But then I start studying, and there is a report from Europe of, in the vets in Europe, they describe the use of Coke as well as an alternative therapy. You say, whoa. So it's not only in Brazil, there is other people around the world also trying that. And then I decided to use in some areas that were problem, because I didn't have much. It was like mares that I couldn't spend a lot of money, and I tried, and they suddenly got pregnant, similar as with kerosene. I say, whoa, there is something here that works. I can't tell exactly what it is. I'm not telling people to use. I'm gonna be really clear here. I just think that it's something that's there. It's being described, needs more studies, but it's being described as a treatment for this problematic nurse.
So I actually have been wanting to ask you this question because I have a lot of end users, breeders that work with veterinarians in their breeding program. And I talk to them about, Botukiller and about a lot of our products, but it's getting their vet on board to try it. What would you recommend to a breeder that doesn't want to insult their vet, but you also want to bring up new technologies, you want to bring up new methodologies to them to try or consider? What is the best way for a breeder to work with their vet on alternative therapies that they've never heard of before?
That's always hard, because it's hard to hear that you need to try something else, right? But I think the vets, they should be aware of what's new. We should be aware all the time what's new there and what can be used. Now, if a breeder has a mare that is not being able to get pregnant, they should be able to approach the vet and say, hey, can we do some alternative therapies with this mare? Are you prepared? The most important thing for me is, are you preparing that uterus to receive the treatment? This is, for me, it's one of the most important things, because people don't realize how important it is. 70% of the bacteria that are inside of the uterus in mares, they are able to produce biofilm. What is biofilm? Biofilm is literally a protection against antibiotics. This bacteria will be protected. You put antibiotic that and won't do anything. So you need to be able to remove that first, to prepare that to removing that biofilm using these alternative therapies. Iodine, hydrogen peroxide. There are other commercially available like EDTA trees that you can also find, and DMSO, dimethyl-sulfoxamide, and Botukiller. They all can be used to reduce biofilm. So I would use all these therapies first, and then after, you can do your traditional treatment with antibiotics. But I think this is really important, and this is what some people lack, and then get poor results later because they don't prepare the uterus well.
Yeah, I think it's so important to set up the conversation of it's not just something that I heard online. This is something that another vet actually has talked about at the AAEP. So shout out to AAEP. There are studies behind it. And it's not just some idea. Now, imagine if you just heard, yeah, let's try putting Coca-Cola in the mare. That's one thing. Like, we don't have the studies on it yet. We've got some data, but it's not the same as, let's say, like yourself and Dr. Igor doing a study on Botukiller or doing a study with, PRP or whatever. So I think having that information with you when you present it to that vet you're working with versus just saying, hey, this isn't working, we should try something else.
So I think that's perfect.
In your opinion, where do you think the endometritis, like what's the next frontier? Like is it avoiding that, or is it, a better treatment?
I think it's always avoiding. That's the best approach. And how we avoid endometritis, basically, it's best practice. You need to have best practice in equine medicine. What's best practice? Good hygiene. It's basically like the anatomy of your mare. If that anatomy is normal, if the mare needs any surgical procedure to improve that anatomy, that will improve the reproductive outcomes of that mare. Cleaning of her external genitalia, knowing how to breathe the most cleanest way possible. Use semen that you are confident that does not carry any contaminants. So those are important things associated with this. Know when to approach that mare, when to lavage that mare, know what type of solution you are using to lavage that mare. So these are really important aspects. Prevent endometritis. Know that if you have, for example, embryo donor mare, you need to know that at the beginning of the season, she hasn't been manipulated as much, so she will probably be less susceptible to endometritis than when you compare with the same mare at the end, that she has been flushed several times. She is like, just think about the uterus at some point gets tired. Say, okay, I can't deal with this anymore. So you need to know when to help with these animals. And sometimes I say, sometimes people get so like overwhelmed with these things. And sometimes the best thing is do nothing. Sometimes people create an endometritis because they do too much. So you need to understand when and how to approach this animals. This is really important.
Yeah, those are all great tips. Again, Dr. Lorenzo, I appreciate your time. Thank you for re-recording this podcast with us. And I will link your Instagram. I think you told me that's the best way to get a hold of you. Yeah, if you have any other topics that you want to talk about in a future episode, I think that would be welcomed. You're a wealth of knowledge and a breath of fresh air. So I appreciate your time.
Oh, thank you. Anytime you need, I'm here.
Awesome. Thanks, everybody, for tuning into the EQPOD podcast. If you haven't already, please click the like and subscribe button. And if you have any other topics that you want me to cover or find interesting that you want me to interview somebody, comment their name, and I'll try to reach out and do my best to get them on the show. But with that, I wish you guys a very happy new year, and we'll see you on a future episode. Thank you.